An overview on body dysmorphic disorder. Body dysmorphic disorder is a body image disorder in which a person becomes fixated with a minor or even non-existent imagined defect or flaw in their physical appearance. People with this disorder will have persistent intrusive thoughts about their appearance and will perceive themselves as ugly. People with BDD may spend hours a day obsessing over their perceived flaws and trying to fix them. They often become obsessed with looking at mirrors and scrutinizing their appearance. They constantly think about their appearance and try to hide their perceived flaws however they can, often through styling and/or the use of makeup. They tend to believe that people are constantly looking at their flaws and judging them for them. This leads them to avoid social interactions and situations, especially during the daytime when their perceived flaws can be most visible. They often become obsessed with grooming and develop habits like compulsive skin picking and pulling out their hair. For example, picking at blemishes or plucking body hair. They tend to consult doctors often about cosmetic surgeries and other cosmetic procedures in order to try and fix their appearance, and can even become addicted to cosmetic surgery after not being satisfied with the results of the surgeries. All of this can severely affect their relationships with others and lead them to live in isolation and become lonely, which in turn can increase feelings of anxiety, depression, even escalating to suicidal thoughts and tendencies. Some of the most common concerns of people with BDD tend to be the nose, skin complexion, acne and blemishes, hair thinning and balding, their body build and weight, muscle size and tone. Concerns about things like weight, the size and shape of body parts like legs, arms, and hips, and skin complexion tend to be most common in women, and they are more likely to pick at their skin and use makeup to hide their flaws. Men tend to be more concerned with their body build, muscle tone, hair thinning, and genitalia, and are more likely to cope by wearing hats to hide their hair or turning to alcohol abuse or dependency. What may come as a surprise to many is that studies found that BDD is actually quite common in people, more common than disorders like schizophrenia or anorexia nervosa. It usually develops in teen and adolescent years, around the ages of 12 to 13, according to the American Psychiatric Association, and affects about 1.7 to 2.9% of the general population. Studies also found that the differences in men and women being affected were slim, with 2.5% of women and 2.2% of men in the U.S. suffering from BDD. Though exact causes are still unknown, there are a few theories of what might cause BDD to develop in people. Many believe that biological and environmental factors may trigger BDD through traumatic childhood experiences, low self-esteem, peer pressure and pressure from the media to fit into certain ideals, parents who can be especially critical of their children, and cultural norms and expectations. Studies show that BDD also tends to be comorbid, meaning it often occurs coupled with other mental disorders, most commonly anxiety and/or depression. The most common and so far the best treatments for BDD have been cognitive behavioral therapy and medication. Cognitive behavioral therapy focuses on working to change and reduce BDD-related thoughts and behaviors, breaking the usual negative habits that those with the disorder have developed. As for medication, serotonin reuptake inhibitors, aka SRIs, have proven to be the most effective medication in treating BDD. In one study, when compared to other medications, it was found that patients responded to SRIs 58% of the time as opposed to only 5% for other medications. When the study was expanded, the results were quite similar. There is still much to learn about body dysmorphic disorder and its causes. As of now, with still so much unknown, there are no sure measures that can be taken to possibly prevent this disorder, but continued research and focus has helped us to learn more about body dysmorphic disorder and how to diagnose and treat it, and can help improve the lives of many who are suffering and those who may suffer in the future.